2 weeks ago I had malaria and I was down for 2 weeks. So whilst there, I was imagining how children feel, because if this is the extent of pain that I'm feeling as an adult, how will the child feel?
It's not acceptable in this day and age that we still have many deaths and many people that fall sick from the disease. Because of the sheer numbers, it's crippling the health infrastructure. So by controlling malaria, we'll be able to improve healthcare in general in our societies.
The malaria parasite's life cycle is very complex. The vaccine actually works by attacking the parasite very early on in its life cycle, inducing immune defenses of two types. Antibodies that attack the parasite while it's swimming in the blood, and T cells that attack the parasites after it enters the liver.
To date, there are no vaccines against human parasites. So to stimulate the body's immune system to fight off a parasite is a major challenge.
One would wish that people who are most affected by the diseases participate actively in the finding of solutions to the problem. The capacity that has been built for the trial was not only for us to be able to do the trial in internationally recognized standards, but also to do it in a manner that the communities that participate benefit. So, for example, in our area, the quality of clinical care that participants and non-participants receive is among the highest in the country.
Though the vaccine is coming from Belgium, with sponsorship from the USA, it's Africans who are leading the forefront. So it's Africans that are identifying the problem and trying to get an African solution to the problem. And that is very good.
We had to show that the vaccine could be given along with other childhood vaccines so that in the end of the day, it could in fact be delivered through the EPI system, which is the mechanism for which almost all children in Africa receive their vaccines.
It would be an extraordinary result if phase 3 did show what we hope it will show. I think that for Africa, for a disease that is killing close to a million children,
be compliant with, and they have to translate those into operating documentation of their departments. In addition, it's up to them to write it into the departmental and the individual.
GSK, or GlaxoSmithKline, is the largest pharmaceuticals company in the world, and it made $31,000 a minute in 2006. The name is the result of more than half a century of mergers that have involved New Zealand's Glaxo, Wellcome in the UK, Beecham's in Britain, the US's Smith & Kline companies, as well as a host of others. As it made its $31,000 a minute, the HIV-infected of the poor world were facing waits of 20 years for new drugs, as they were punished by lobbied lawmakers in Washington for attempting to make cheaper generic versions of GK medicines. GSK is currently lobbying for Republican candidate John McCain. Whilst much criticism of GSK is centered on animal rights testing, this film focuses on elements that may truly affect the company's future earnings. It was 4 years ago that the US Internal Revenue levied the largest back tax claim in history. GSK had to pay $8 billion.
Preach that there has to be quality, but if you don't provide a mechanism, a basis for people to do that, it's going to be very difficult for them to accomplish what you want them to accomplish. This system gives them the basis so that everybody can start with that foundation.
It's grown out of best practice that we've seen in operation around various Glaxo Wellcome companies. Some of our companies out there have already taken the principles, they've applied it, and they're seeing some big benefits from it.
This came after GSK was fined $90 million for overcharging the US government for drugs. The cuttings file on GSK is littered with scandals associated with its abuse of government funding, from using orphans to test AIDS drugs to evade laws on experimentation, to massive tax dodges. The biggest criticism of the company concerns AIDS, which continues to devastate swathes of the world. GSK failed to beat off South African President Thabo Mbeki's attempt to ingeniously use WTO rules to allow cheaper versions of GSK drugs into his country. It was a big fight that suggested to many commentators that GSK was more interested in massive salaries for its board than making a fair profit out of saving the lives of millions. Oxfam in particular took the case up. It was in Italy that authorities publicized what is well known about GSK, that it actively bribes doctors and health services to use its drugs. In just a 2-year period, Italian police said that GSK's bribes totaled more than $250 million. Their investigation, they claimed, saved the Italian government's health budget more than $500 million. GSK issued warnings to its representatives as soon as filmmaker Michael Moore announced he intended to investigate the U.S. healthcare system.
We live in a time where we have a man sending us to war.
At the time, there were growing concerns over its drug Paxil, which the British government concluded was being administered to millions of children, whilst GSK knew that it may have no beneficial effect on them, indeed may harm them. A 1998 GSK memo said, "The company must manage the dissemination of data in order to minimize any potential negative commercial." That memo aided the case which GSK settled with New York now Governor Eliot Spitzer. GSK paid $2.5 million to settle. The company paid $150 million to settle fraud allegations over inflating prices of Zofran and Cutril, nausea drugs. It admitted no wrongdoing, whilst the U.S. Justice Department argued that GSK charged private providers lower prices for drugs so that they could pocket the difference. In May of 2007, GSK shares were hit by proof of increased heart risks associated with its new drug Avandia. For the future, GSK's share price may well be affected by boycotts of its products. To date, Canada, India and hopes in the United States have campaigned for boycotts of GSK medicines. But so far it has been controversy over drugs such as Paxil, Seroxat and AZT that have pushed its stock price down. It is alleged, for instance, that GSK is trying to protect its patent for AZT by slowing the release of a more powerful and less toxic AIDS drug, 1592. Perhaps the best way to look at a company that has settled so many lawsuits that have affected so many millions of people is to look at who works there. CEO Jean-Pierre Garnier, who has come under fire for massive salary packages whilst refusing to lower prices for life-saving drugs in Africa, is also on the board of the company that makes Black Hawk helicopter gunships. He benefits twice from the war in Iraq. His chief finance officer was John Coombe, who, whilst at a company that had the biggest problems with US tax authorities in history, was a member of the Code Committee of the UK Takeover Panel. Its CFO now, Julian Heslop, was an auditor at Stoy Hayward, implicated in many financial scandals, including Polly Peck and the recent savings scam in Britain, Fairpack. Paul Allaire, responsible for salaries, was chairman of Xerox, where he sold $16 million of stock options before the company was found to have used accounting tricks to defraud investors. That investigation by the US SEC. Even financial analysts now look poorly on the company, particularly as it is rushed to improve corporate governance in the face of so many claims that will hit its insurers hard. For the moment, the UK Serious Fraud Office has recently launched their inquiry into GSK's involvement in Iraq, where it is alleged it aided the Saddam Hussein regime. Welcome to Real Global News, the daily newscast covering international stories and perspectives ignored by others.